Good morning, everyone. My name is Guadalupe Ramirez. I'm one of the Nursing Research Fellows for Robotics and Innovation at Christiana.
Yes, and I am also a nursing research fellowship member for our robotics and innovation fellowship. So today we're just going to talk a little bit about our cobots and the research that we're doing with those cobots. So just a little bit about our fellowship and its mission. The mission of this fellowship is to give clinical nurses the opportunity to apply our skills of research that we're learning through the fellowship and kind of bridge that gap in between research and nursing and just kind of help with the intersection of nursing and innovation in healthcare. So the vision is to invest in our nurses' professional development and education in a sustainable way so that we can kind of help to broaden the skill set within research beyond just patient care, to kind of ignite the spirit of inquiry and to provide us with tools that we can apply to our practice area and other areas in the future. So our group is made up of a couple different people. So obviously Dr. Susan Smith, she is our research lead and our fellowship lead. And then Denise Taylor is our research education specialist. And Katie Patel is our administrative kind of behind the scenes coordinator. And then we have two other fellows besides Lupe and myself, Lexi Cornelius, who is a labor and delivery nurse, and Samantha Clark, who is an ICU nurse at our Cecil campus. So the background for this, we all know that nurses spend quite a bit of time away from the bedside, and we found that it was actually around 30% of that time that they are at work, they are spent doing non-clinical tasks like running around trying to find equipment, do deliveries. So because of that extraneous time that they're spending away from the bedside, we figured that that was probably causing a decrease in satisfaction, not only for the nurses, but also for our patients. You figure they're not getting to spend as much time with their patients, so they're going to be having just decreased job satisfaction overall. So the thought was maybe we could incorporate these delivery robots to potentially offload some of these tasks from nurses and PCTs so they're able to spend time doing what they love instead of running around trying to kind of keep up with the rest of the shift. So the purpose of this study was to implement these robots and then explore the perceptions that all of our staff that are interacting with these cobots are having. So kind of seeing what their thoughts are, especially in such a large tertiary hospital setting, just seeing what people are thinking about the robot and seeing if she's actually doing what we think it's doing. So a couple of things that we'll go over are our methods for this study. So we have our design and theoretical framework. We did an implementation and feasibility framework, and we focused on a mixed methods convergent design. So qualitative and quantitative, and doing some side-by-side comparison throughout the study. We did some purposive sampling. So we took nurses and staff members from our hospital, not just clinical, but non-clinical roles as well. And we did focus groups that were 1-hour sessions where we asked 6 different questions with 9 potential probes, and then also did some demographic and Likert scale surveys. And then finally, at the end, for our analysis, we did an inductive coding approach with qualitative description level of analysis and quantitative descriptive analysis. So here's our preliminary results for our kind of demographics of our groups. So we had 29 total staff members. As you can see, a majority of them were clinical nurses, but we did include some pharmacy techs, unit clerks. We had some managers, some patient care techs, equipment room people, and then also some emergency care techs. And then we tried to kind of incorporate from different practice areas as well. So it wasn't all just one unit. It was our med surg, our ICU, equipment room, emergency department. It was kind of all over the place to try and get the broadest view of the types of staff members that we were looking at. So now I'm going to pass it to Lupe, and she's going to talk a little bit about our codes.
Hey, Jordan. So yeah, it was very interesting to get to see. I think we had a pretty good rounded out kind of team of people that we got to survey just to not just see what, even though the intent is primarily to offload tasks from nurses, we still wanted to see how the cobot was affecting the workflows and the workloads of other areas in the hospital. So I think we got a lot of really good information. It was really interesting to go through all that, to all those scripts, and I happen to really enjoy the qualitative aspect of the research, actually. But we went through, and I think the biggest themes that we found within the research was that it is a novelty, obviously, to see a cobot in this hospital setting. I think a lot of people find a lot of joy in it, just seeing it. If you've never seen a cobot, it kind of makes cute little noises at you, it makes little hard eyes. So it's something that people really enjoyed seeing. It brought joy. It's a novelty. It's well received in that way. But we did find through the research that it is mostly useful for non-urgent items. So, if there's an emergency and you need something in that moment, you won't be using the cobot just because at this time there really isn't a way to know like when the cobot is coming. You kind of They have these kiosks, you put in your request, the cobot receives the request, and then depending on where it's at, if it's free in that moment, then you might get your delivery fairly soon. But if it's already out in a delivery or it's already got like a queue of requests, you might not be seeing your request for a while. So we found that people do understand that the cobot is mostly useful for things that are non-urgent. We also found that obviously people found it most helpful when there wasn't enough human resources. So a lot of the time it was probably like off shift. They found that rather than sending their one nurse aide, it was better to just utilize the cobot so that that person didn't have to leave the unit and leave the unit even more short staffed, especially again in moments where like even for pharmacy and stuff under off shifts, they might not have as many runners to deliver all these medications. And as we mentioned, it's a fairly large hospital, so if you're running around, it might take even a human a while to get things done. But we did find that people found it easy to use, which is really great when you're implementing new technology. People found that once they've used it once or twice, they really kind of like got familiarized with it, and they found it very easy to use. And people do understand that it does have its limitations. Again, in hospitals, you can have things that are this small, or you can have things that are ginormous. So, it's great at delivering maybe like medications and medical records. But if you need a commode or if you need a pole for medications, the cobot just unfortunately cannot deliver that. And then we also found, which was really interesting, that it really influences the cognitive load, meaning that even though you might not know when your delivery is coming, they found really useful to just kind of be able to offload that. So if you know that you need something that's not non-urgent, you can just put it into the request and just forget about it, which is really great just really great, again for the for the nurses, so that it's just one less thing that they have to worry about. So even though they might not be getting it soon, they know it's coming, they can just forget about it. Next slide, please. So again, from our survey results, again, the biggest kind of things that we found is that while you may not know when your delivery is coming, people do find that it saves them time. So that's always well received. Again, they feel that the cobot really supports them when they are short staffed. And one of the things that we joke about is, when we're going through this research, especially through the scripts, you could go from somebody saying like, yeah, like it's great, it's so fast, I'm getting my deliveries right away, and then 2 3 sentences later people were like, yeah, it takes forever. So even though it might take a while, people do believe that sometimes it's more efficient than humans. We don't know if that's also related to some of the scheduled deliveries that they would have, or they would know that they were getting certain medications at a certain time, or they know that maybe cobot is the cobot. Once it has the task, then that's what it's doing, unlike humans who maybe you're doing something and you might get sidetracked or you might get grabbed, and the next thing you know, that task that you were doing got bumped off. The cobot can't do that. It doesn't really have the power to really kind of like stray away from the task that it's been given. And then again, kind of like what we Jordan was saying, which is kind of like the goal is that they do find that it gives them X amount of time back to be able to prioritize that hands-on care, which is really the goal of the cobot. Next slide. So for our early implications, what we found is, again, you're going to be utilizing the cobot mostly for either routine tasks that we know are going to get scheduled, like first thing in the morning, it's going to drop off maybe medication to this unit, or for non-urgent tasks. And we did find, again, that since the robot's not really coming and, doing like cleaning up your patient or anything like that. It's gonna a lot of the time offload mostly for the ancillary staff, which is good, but it's not really the main purpose of the robot. So again, we did find that the impact that it had on the workflow of nurses wasn't as great as we hoped for. But we do recognize that, like we mentioned, the hospital environment is very complex. There's so much going on. There's so many things that can change from one second to the other. So we do recognize that it does limit its autonomy because sometimes you can't predict everything, and the robot really can't work around that. But again, this is like very early on, so we hope that, with some tweaks, it can also be made to be more useful for nurses. Next. So, that's all of our slides. If anybody has any questions, we would love to take some.